That's a good question. Again, this depends a bit person by person, but it's known, in fact, from the late 20s, and then I talk more about 30 years old, then your collagen degradation is taking over from your collagen generation, which means, in fact, that you have more breakdown of your collagen than you have the formation of collagen. And then it's recommended for a normal, healthy person at the late 20s to start to take collagen bit by bit, and this needs to be done on a daily basis. And you will see, in fact, very quick, you will see the effect on your skin health. What is known, for example, if you talk about the joints and you talk about bone health, this comes in a later stage. Let's say your bone degradation, let's say when you talk about osteoblasts and osteoclasts, in fact, they have a natural equilibrium, but if at the age of about 40, you will see that then your cartilage and your bone will start to degrade. So it needs to be taken in, let's say the late 20s, at least before you're 40. And this is quite important to understand. If you have an oral intake of collagen peptides, and if you take the native collagen, it needs to be digested in your stomach, needs to be digested in your small intestines, and this takes a long time, which means, in fact, that 50, 60, 70% of your native collagen will go through your metabolism without having any effect. If you take the low molecular weight collagen peptides, as we produce, and starting at 5,000 Daltons up to 2,000 Daltons, we have proven through scientific work, in fact, that the bioavailability is very fast, and about 90 to 95% of the collagen peptides which are ingested, they come and end up in your bloodstream. And this is where these collagen peptides have to go through. So they have to go into your blood and go to the target area where they have to cure the disease you're suffering of. Let's say for your joint health, it will help, in fact, the degradation of your cartilage. So you know, in fact, in your knee, for example, you have a lot of cartilage which is present, and due to extreme exercise, this cartilage will then have a degradation. If you have a daily intake of collagen peptides, there will be a kind of regeneration of your collagen when you are a young person, and then your cartilage will stay intact. That's one. The second effect is when you already have a degradation and the generation is not as much as the degradation, then you will have pain and inflammation of your synovial fluid. And then if you have a daily intake of collagen peptides, you will see, in fact, that the inflammation goes down and also your pain goes down. And that's the secondary effect, let's say. It's not going to generate enough collagen, but it helps you reducing the inflammation, and it helps to reduce the pain. Well, let's say this is a bit different from what you target. As I already said before, for skin it's quite fast. It might happen already after 4 weeks, even earlier if you think about moistening and hydration. If you think about joint and bone, this will take several months. It means, in fact, people who start taking collagen peptides, they have to be courageous, let's say, and quite patient, because this will only happen after 3-4 months. And then once you have the effect, then you have to maintain and then continue to take it daily. So it needs, let's say, in the beginning, it needs a little bit of courage before you see the effect. That's a fact, yeah. So what will happen, and this is something that happens a lot with people. So they start taking collagen, they see the effect, they have a healthier skin, they have less pain, less degradation in their cartilage, and they say, "Oh, now I'm okay." So I'm again at the level as before. And they will see, in fact, that the effect lasts if they stop taking collagen peptides. they will see that the effect will last for a few weeks, and then bit by bit, in fact, the wrinkles will come back, the skin will dry out again, you will see that your inflammation will start again, you will see that the pain will come back. And then this is like what we call a yo-yo effect. So if you do this, it comes back, and then you start again, it comes back, you start again. And that's not what we want. So people have to start, and when they start, they have to take a daily, until the end of the day, let's say until the end of of your life practically, yeah. Well, let's say Rousselot has a very different approach of other producers. So in fact, we have a very dedicated process, and in our process, in fact, we select certain precursors. In our gelatin process, we select a certain dedicated precursors which are made according to a very specific production process. Once we have these precursors, we apply a very specific enzymatic process to do a kind of a fractionation of your different components. And this gives you a very narrow distribution of your collagen peptide. So if you talk, for example, about the 2000 peptide, Dalton peptide, you will see in fact that if you look into the distribution of your collagen peptides, this is a very narrow distribution, the same with the 5000. What other producers make is a random collagen peptides with a very large distribution. And this might give the effect of having these collagen peptides which give the activity not being present in a large amount, and the effect will be much less. That's a difficult question, and a good question as well, because we are all a little bit triggered now what is happening with the COVID-19, and this is about immune systems. And I don't know for the other proteins, but I know for collagen peptides, this has never been scientifically proven. So if you really want to state, in fact, that the collagen peptides have a beneficial effect on your immune system, you have to go through clinical studies. And this is too early now. So we cannot say it is the fact. But what we know, in fact, is that some producers, they already launched a product which they call immune booster. And you always see that this is in a combination with other components, for example, with zinc, with other vitamins, etc. And these things together, they might help, because what we can say from collagen peptides is, in fact, they have this secondary effect, and the secondary effect on mobility. And we know that people who are in a good health situation, who are mobile, who do a lot of exercise outside running, etc., they have a better immune system. So this is one. The other secondary effect is weight management. And we know that proteins, and not only collagen proteins, but all proteins, they work and they are very effective for weight management. And we see, in fact, with the COVID-19, that a lot of people who suffer now from the infection of COVID-19, these are people who are overweighted and are obese. So these are people who have less mobility, and they are attacked, in fact, by the coronavirus because they have this overweight. And collagen peptides help, in fact, in weight management.